Hi everyone, Dr. Sylvestre here. In this video, I'm going to tell you what I think is a good way to go from having taken a course, whether it be online or hands-on, and then feeling comfortable enough to actually do the surgery on one of your patients. The other question that I would get asked a lot, especially during my extracapsular repair workshops, is, okay, I feel I can go do this surgery now, Dr. Sylvestre, but how do I handle it? How do I tell the clients that I can offer them this? And how do I deal with that, right? Because face it, you just have gone out, you've learned to do a new surgery. You may have practiced, you may have taken the course twice in a 6-month period. You've done a ton of cadavers, but you've never done a live patient in somebody's pet. And that is totally different. So it's important that, one, they understand what your skill level is, and two, that they understand what their options are. So your skill level is, Mrs. Smith, I have never done this surgery before. You need to know that. However, I have taken all the necessary training. I have practiced the surgery on cadavers. I have done all my due diligence, and I feel ready to do this procedure on your pet. Also, your pet is a good candidate for this procedure. He's not too big, he's not too small, he's got the right personality, because of course you're going to apply case selection on your first case, right? Don't do the 210-pound Mastiff. Even I want to send those cases elsewhere. Once you've informed your clients of what your readiness is within your skill set, then they can make the decision. They also need to know what their options are. If they are uncomfortable with being number one, then you gladly will refer them. Maybe you have a traveling surgeon that'll come to your hospital. Maybe you send them away, or maybe you'll help them with an alternative to surgery if referral is absolutely not an option. And usually it's the ones that where referral is absolutely not an option. They're happy to entertain being the first one for you. Once they understand your skill level and they also know what their options are, then you kind of have to give them some incentive and come up with an agreement. I have found that a good incentive is not charging them for the surgery. Now, you may want to charge them for some of the hard costs, but not charge them the surgery fee, and give them good discounts, right? Like, take care of the professional fees. CE is something you pay for. Your first case, as well as your second and third, and maybe a few more cases, they're still considered continuing education. You are still learning this technique. So learn. You have to learn. You need to get experience, and that's a way to do it. So offer them a good discount. When I first learned to do the TPLO, I already had my mobile practice, and this was 1999. The TPLO was just becoming a little more popular out there. I went and took the course, and then I told all the practitioners whose hospitals I would go into to do surgeries that I'm now trained to do at TPLO. I had practiced, I'm pretty comfortable with orthopedic equipment, and I'm pretty comfortable with the stifle, but I did a bunch of cadavers in my home. Yes, I have cadavers in my home. So when I was on the road, I did not charge a surgical fee for my first dozen TPLOs. I did not charge a full professional fee until I felt I had enough under my belt. And I would tell the veterinarian whose patient I was going to go work on, this is patient number 3, this is patient number 10. The other thing you want to make sure is that, and this is more of an agreement, but that you are going to follow these cases up. I would not charge for the follow-ups. Actually, I never charge for follow-ups. That's just all embedded in my surgery fee because I want people to come back for follow-ups. That's where you prevent the disasters from happening in many cases. But as a new person to this procedure, you need to see how they're going to do at every step of the way. And as part of the agreement, they need to make sure that they show up for the follow-up. So I always recheck my TPLOs 2, 4, and 8 weeks after the surgery. If you are totally new at this, I would suggest maybe you do 5, 10, 21 days, and then maybe the 6-week mark and the 8 or 10-week mark, something like that, so you can see how they're doing long-term. I have some people that also will then request to see them at the 6-month mark, just to see how they're doing, and that's a really good idea. That's how you learn. You don't learn by reading a book when it comes to post-op and how the patients should do. You need to see them. Also, you're going to want to take follow-up radiographs. These are all the things the client must show up. The other part of the agreement being that they understand that they're number 1 or number 2 or number 3 on your list, and that your experience may not be as high as some others, and therefore if something does go wrong, the agreement is that you send them to a specialist, that you refer them somewhere at the owner's expense, or maybe that you do a revision surgery. At that point, I would say at your expense, because if it was your first, second, or third TPLO, guarantee it's your first revision surgery, right? So at your expense. But that you also put an end to things, right? If it's not going any better, maybe we just learn how to manage it this way. Make sure you put in the pet's record all of your conversations in, right? And if something does go wrong, 1, your client was fully and totally aware, and usually they get it, you know, as long as they know. What they would hate is if things don't go well, and then they find out that they were your first or second TPLO. That doesn't go over very well, all right? But make sure you document all your conversations about what this agreement is, that they know that you're new at this procedure, although you feel ready, and that they agree. If the owner has any trepidation, just move on to the next. Don't agree to do this one. It's not worth the loss of sleep and the worry and the headaches if things go wrong. That's my opinion. The other thing I would recommend when you're learning a new procedure is to keep a surgical log. Actually, with TPLOs, I kept a surgical log my entire career, so there is a ton of them in there. The kind of things you want to record in a surgical log, in your surgical log. I'm not talking about the patient's record. Just keep a log, keep a spreadsheet, clearly the patient's name and date and what the procedure was. Left TPLO, right extra cap, whatever you did. And then maybe a note, if I was doing a TPLO, I'd have my pre and post-op angles written in there. Then I would write myself a note. Surgery went great, trouble with the rotation, plate bending. So whatever I might have struggled a bit with or questioned a bit in surgery or on my post-op radiographs, I would put a note, you know, nothing elaborate, just put a note, and then I would record how the dog's doing in the follow-ups. And again, it would just be, okay, that means, you know, yeah, he's where I expect him to be. But if he develops something, if he's got a pivot shift, if he's taking longer to come around, something like that, I'd keep an eye on that. And then I would go back and check my logs every so often, and I would go, when I felt this, I got that. When I saw this, didn't matter. Dogs did great. That will help you keep track on how your new surgical procedure is going. It will help you learn, so that's for you. The kind of numbers of cases I would suggest you do to get through your learning curve with a TPLO would be about 12 cases. So yeah, I'm saying you should do a bunch of them at no charge, or at least a reduced charge. And the follow-ups, that's forever, right? You don't just stop following them up because you got good at doing the surgery, because it's all about preventing issues, and you can often do that with a good follow-up. Extra caps, the extra capsular repair, I would usually recommend that people considered 5 or 6 of these procedures to be their learning curve. It's also important to understand that when I say 12 surgeries for a TPLO or 5, 6 for an extra cap, I don't mean 12 over 10 years. You need to be able to get your 12 in, within a relatively short period of time. Beautiful would be to get 12 in within 12 months or sooner, because then that muscle memory is just going to kick right in, right? You do 1 a year, don't do any at all, because you'll never get good enough at them to do a good job. So you need to make sure you're going to have sufficient cases to be able to do that. One of the things you might consider doing is recruiting from neighboring practices, right? They may be looking for a place to send their TPLOs, and the referral hospitals are booking 6 weeks out. You can do better. But also make sure that everybody knows where you're at with your skill level, and then they can make that decision, right? It's a decision that they're making, and they understand why they're making this decision, and yeah, it fits their timing and it fits their pocketbook, and you're going to learn more. That's an effective and ethical way to get experience with the new surgery.